Hi, welcome to this episode of Patient Education for the Educated Patient. This is going to be the first episode or the pilot episode in a series of episodes I hope to make to help educate patients who are looking to separate fact from fiction on the internet. The first topic I'm going to talk about is morning sickness. This has to be the most common question and concern for all new pregnant women. They don't know if it's normal. They don't know how much is normal. They're afraid for the baby. They're afraid for the pregnancy. So this raises a lot of questions. So I'm going to lay down the basics. It's not at all meant to be comprehensive, but it is a foundation to build upon and manage your symptoms and to mitigate some of your concerns. So let's talk about morning sickness. First, the take-home points. These will be represented at the end of the video, so there's no need to try and jump to the end. So point number one, be conservative. That is the most important part of managing morning sickness. Number two, be progressive. You want to start with the simple stuff and work your way up to the more invasive or riskier things such as prescription medications. Number three, you want to hydrate properly. And hydration is not just water. That cannot be stressed enough. Too many times patients are really dehydrated, yet they cannot understand why drinking a bunch of water does not fix the problem. And we'll talk about that. But you have to hydrate with water, sugars, and electrolytes. The most important one being sodium. Number four, beware of the ketone cycle. And that kind of ties into what I just talked about with proper hydration. But we'll talk about the ketone cycle and what that means, because if ketones are building up in your body, it becomes a new entity all on its own that is totally separate from the morning sickness itself. And lastly, be conservative. That will be the first point and the last point of this video, and you will see why. So let's talk about being conservative. Morning sickness pretty much occurs during the first trimester. This is also the most important time of the embryo development, because this is when the little embryo is developing all its organs, limbs, extremities. So you have to be very careful with what you expose the baby to during this critical period of time. And as you can see from this table, this is taken out of Williams Obstetrics textbook, that the embryonic period encompasses weeks 3 through 8. And a majority of the major birth defects occur during exposures in this embryonic period, and a few into the fetal period. But you can see why morning sickness coinciding with the organogenesis can be very detrimental to the baby's development if you're not careful with what you expose the baby to. There is no clearer example of risks to the baby than thalidomide. Thalidomide is the poster child of what can go wrong. It is commonly cited by people advocating for the FDA, the role of public health, and especially for birth defects in pregnancy. This was a drug that was used off-label, mostly in Europe in the 50s and 60s for morning sickness. Early studies had shown that thalidomide did not cross the placenta in rats, and so they assumed it'd be safe in humans. Sadly, the rat safety data did not translate to humans, and we were left with a lot of birth defects. Thalidomide, unfortunately, impaired the limb development of embryos, leading to what's called flipper limbs. And so it's, again, the poster child for what can go wrong if you take the wrong medications or are exposed to the wrong things in the first trimester of pregnancy. So again, along the lines of being conservative, you have to hang in there. Morning sickness follows the pregnancy hormone levels rise and fall. So the human chorionic gonadotropin, or the pregnancy hormone, rises rapidly, but peaks at around 100,000 at 10 weeks. So at 10 weeks, you typically have the worst morning sickness of the entire pregnancy. After 10 weeks, it doesn't matter what you're trying, your symptoms are going to get better. And so that's why sometimes it's very hard to distinguish what's actually helping your morning sickness. Is it that just because you started using this certain medication or this certain method or change your diet, or is it that these symptoms were already getting better on their own? So that's why we're going to talk about some of the studies to help separate what will help and what is not going to help. So here's a chart of the rise and fall of the human chorionic gonadotropin, the HCG, or the pregnancy hormone level. Pay attention to the left axis here. The left axis is not drawn to scale. Again, the symptoms peak at about 10 weeks, and by 14 to 16 weeks, a lot of your morning sickness will have resolved on its own, whether you treated it or not. So don't go straight to medicine. Again, trying to be conservative. And first things you can do are smaller, more frequent meals. So instead of 3 meals a day, studies have shown that nausea improves if you start snacking maybe 8 times a day instead of 3 large meals a day. You can also shift your diet from something heavy in fats to something more protein concentrated, because that has been shown to decrease nausea. Iron is tricky because iron's in all your prenatal vitamins for the most part, but iron has a lot of GI side effects, causes some gastritis, gas, pain, constipation, sometimes gives you an upset stomach. So you can switch your prenatal vitamin containing iron for prenatal vitamin without iron, or a multivitamin with plenty of folic acid in it, just to help mitigate some of your GI symptoms. Hydration, we talked about this at the beginning. Hydration is very, very, very important when you're having morning sickness of pregnancy. But again, hydration is not just water. It includes water, sugars, and electrolytes, the most important one being sodium. So the last thing is the boat diet, or the brat diet. But the boat diet stands for bananas, oatmeal, or rice, applesauce, and toast. These 4 foods have very high calorie concentrations, yet they have very low gastric residual times. That means they get in your stomach, they get out, they don't sit there causing a lot of nausea. So only if it gets worse do we progress to pharmacologic treatments. This is the algorithm put forth by the American College of Obstetrics and Gynecology. This practice bulletin is dated January 2018. It's updated every few years. So if it's been a while since 2018, you want to look for the latest copy or the latest edition. But again, first line is non-pharmacologic options, followed by this decision tree for different pharmacologic options. So over-the-counter remedies, the most famous one is ginger. A lot of times we recommend ginger, but we're blown off. They're like, there's no way ginger helps. I'll give you some prescription medications. But the fact is, ginger's been around for a long time, and studies have shown that it works. Ginger has worked, and its efficacy has been proven in randomized, double-blinded controlled trials and crossover trials. Not only does it work for 4 days, there are some studies suggesting that the anti-nausea effects of ginger will last another 4 days after you last took ginger. So it's a very good medication or herbal treatment for morning sickness of pregnancy. And there have been plenty of studies to flush out its safety, since it's been around for a long time, unlike some of these newer prescription medications. Ginger has been around long enough that we have very good safety data for ginger. But keep in mind, the safety data is limited to 1 gram of ginger a day for about 4 days. But again, if you're taking ginger for more than 4 days and your symptoms aren't getting better, it's time to try something new anyways. Moving on, the next step for pharmacologic options, as recommended by the American College of Obstetrics and Gynecology, is vitamin B6 plus any of these antihistamines. All these antihistamines and the vitamin B6 are all available over the counter without prescription. So it's very easy to self-treat and self-manage if this will work for your morning sickness. So Unisom, Benadryl, Dramamine, these are all antihistamines in the same family. They all have very good and clean safety data during pregnancy, as well as the vitamin B6. So try this first before trying prescription medications. Now, if you're still not better after trying vitamin B6, ginger, antihistamines, then you need to see your doctor because it may not just be morning sickness. You may have liver disease, thyroid disease, some neurologic problem, some sort of infection that needs to be worked up. But see your doctor, work with your doctor, make sure it's nothing more serious, and then you can consider prescription medications to manage your morning sickness. So prescription medications, there's a whole list of them. Now, just remember less is more. You want to take the minimum amount of prescription medications, enough to manage your symptoms and get you through the day. And like I said, you're trying to get to past 10 weeks. Once you're past 10 weeks, your symptoms are going to get better with time alone. So remember, if the pills are making you sick, prescription medications do offer the advantage of having different routes of administration. That means you can take rectal suppositories, oral dissolvable tablets. These will all help manage your symptoms because these don't require pills that sit in your stomach, because sometimes just taking a pill by itself will make you want to throw up. So if that's still not working, then you have to consider that it may be ketones causing your nausea and not just morning sickness. And so the ketone cycle is something that can take on a life of its own if left unchecked. So in this case, it starts with pregnancy. Pregnancy leads to nausea, which leads to vomiting, which means you no longer have a source of food to feed your body. So your body starts turning to burning fat. And when you burn fat, there's a process called ketogenesis or beta-oxidative ketoacidosis. And what that does is generate ketones. And ketones are very nauseating. It's your natural drive to eat by generating ketones. You just get very hungry, you get upset, you don't feel good, and you can get very nauseous. And eventually ketones become the source of your nausea and not morning sickness and not the pregnancy. So now you have this ketogenic cycle that has taken a life of its own, and now you must break yourself out of this cycle. Otherwise, it's only going to get worse. Now, the first mistake that patients make is they try to treat the nausea with medications. They stop throwing up and they think that's enough to break the ketogenic cycle, but it's not. Now, the second mistake people make is drinking a bunch of water because they are not keeping food down and they think that drinking a bunch of water will break them out of this ketosis cycle. But that's not true. What your body needs are sugars. Your body wants to burn sugars instead of burning fats. Burning sugars will not generate ketones. Burning fats do generate ketones. So you have to get sugars into your body. So that's why I talk about hydration. Hydration is very important, and it has three components: water, sugars, and electrolytes, most importantly sodium. So if you're going to be drinking a bunch of water, you need to pair it. You need to pair it with saltine crackers, French fries, goldfish crackers, anything with a lot of salt. That will definitely help you break out of the ketosis cycle. Now, ketones are very easy to check for in your urine because when your body is full of ketones, your body gets rid of them by the kidneys and into your urine and out your body. So in our office and in the emergency room, it's very easy to check for ketones in a patient to measure the degree of severity of their symptoms. All you do is take a urine sample, take a test strip that you dip into the urine sample, and these things will turn different colors depending on how severe the amount of ketones are building up in your body. So you can buy these over the counter just on Amazon at your local drugstore. They're very cheap. They're very reliable, because if you're starting to build up ketones in your body and you're unable to keep even liquids down like Gatorade, then it's time to go to the emergency room because you're going to need an IV. So remember, going to the hospital is not a big deal. I don't want you to shy away from going to the hospital. Hospitals are perfectly safe for you, the pregnancy, the baby. In fact, it's the safer thing to do than to suffer. So go to the hospital, get your IV. And remember that IV medication is going to have a lot of things. A lot of times you're going to get thiamine first, or B1 through the IV. Then you're going to get IV fluids. IV fluids are going to have a lot of sodium or the electrolytes that you're missing. You're going to get sugars directly intravenously, like dextrose, which is what we use in the hospital. And you can also get your vitamins via the IV while you haven't been able to keep your vitamins down at home. And finally, you can give patients medications through the IV to avoid that problem we talked about, where you take a pill in your stomach and you want to throw up immediately. So intravenous IV medications can start making you feel better much faster than any of the pills, the rectal suppositories, or even the oral dissolvable tablets. So long story short, if you have to go to the hospital, go to the hospital. You're going to feel much better. It's going to be safer for you. It's going to be safer for the baby. And it's a very easy thing to do. You're really just buying time with IV hydration so that your body can clear all these ketones out of the urine. And then you're going to be feeling much better. And if you're afraid of hospitals, work closely with your obstetrician, because some offices like ours will do IV hydration in the office to help keep you out of the hospital and keep you out of the emergency room. And it's much easier and cheaper to do it in the office than in the emergency room. The other thing is that you can arrange home health services. Insurance companies are much happier sending a nurse to your house to give you IV fluids, IV medication, IV nutrition, than you going to the emergency rooms. Want to save them a lot of money. So, coordinate with your obstetrician to make sure that you are as comfortable and healthy as possible for the sake of the pregnancy and the sake of the baby. Now, the silver lining is that patients often worry, is something wrong? Is something wrong? My friends had pregnancies, but they never had morning sickness, or my last pregnancy, I never had morning sickness. Does that mean there's something wrong? And the answer is no. There's very good data out there to show that morning sickness does not increase your risk of miscarriage, and it does not increase the risk of birth defects for the pregnancy. So rest assured, the pregnancy, the baby, they're all fine. We just have to make you feel better so that something bad doesn't happen. So again, the take-home points to summarize everything up. Number 1, be conservative. First thing we talked about, be conservative. Number 2, do a stepwise approach to your management of your symptoms. Start with dietary changes, over-the-counter medicines, prescription medicines, IV medicines. Finally, hydration. I cannot stress this enough. You cannot just drink water. You got to drink something with water, electrolytes, and calories. So my go-to hydration for my patients is Gatorade or Powerade or some sort of sports drinks, because that's going to take care of all 3 things: water, electrolytes, mostly sodium. That's why Gatorade tastes so salty. It's chock full of salt, and there's plenty of sugar. And again, we're trying to switch your body away from burning fats to burning sugars to get rid of the ketones. So the last point is to be aware of the ketone cycle. And again, to summarize everything up, if you learned anything at all, you have to be conservative. This is a very critical time in the development of the embryo. So you have to be conservative. You have to do what's best for the baby and yourself and for the pregnancy. So hang in there. Like I said, the symptoms will go away and start getting better at 10 weeks. They'll be gone by 14, 16 weeks. So stay safe, stay smart, stay educated. That will conclude our first episode of patient education for the educated patient. In the description below, I will leave links for the ketone test strips for your urine if you want to monitor for that at home. I can leave links for vitamin B6, some of the antihistamines, ginger supplements, and finally, my go-to recommendation for my patients with severe morning sickness or nausea and vomiting is powdered Gatorade. Easy to carry around in your purse. You just add it to water, and then you'll be able to get your water, your electrolytes, and your sugars. And powdered Gatorade has the added benefit that they use dextrose as a sweetener instead of sucrose, where sucrose is basically a glucose compounded to a fructose. And, fructose gets a lot of bad press, whether it's warranted or not. Powdered Gatorade will work around that fructose. So powdered Gatorade, good source of glucose for you. If there's any questions, please feel free to comment. I'll try to answer all your questions down below. This is Dr. Chang. Take care. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.